welcome back to the next episode of TILLY. I'm your host, MArisa Zeppieri. TILLY is brought to you by the Lupus Foundation of New England. Every week, Tuesday night at 8 o'clock, we have a guest that is living with lupus or chronic illness. We have medical professionals, complementary therapy personnel, and caregivers, and more. So you can go back into our video library. We have over 60 interviews. And tonight we are doing more of an intimate interview because I actually have Nicole here in person. Nicole has spoken with us before, back in our earlier seasons, about hair loss and also about treatment that you received for it, and wigs, and just all kinds of things that come along with lupus and chronic illness and losing your hair. So I want to jump in. Well, first, I want to thank you for being here with us tonight.
No, thank you. Yeah, it's great.
For anyone that hasn't seen your prior interview, can you share a little bit about your lupus journey in general and how you were diagnosed?
Yes, yeah. I'm 50 now, which even saying that number makes me want to throw up. But anyway, I was diagnosed back in 2005. So I believe I was 32, maybe a little bit older than that. Basically what happened after the delivery of my third child, it was a little bit traumatic, and I had noticed that my body was going downhill. And what I mean by that is it was a traumatic delivery. First and foremost, she was born in Okinawa, Japan, where I was stationed with the Air Force, and I worked there. So I knew I was in good hands, but the delivery was pretty traumatic. And about 6 weeks after she was delivered, I started to have extreme fatigue, joint pain, rashes, just a number of, probably a number of symptoms that most lupus patients go through. The first thing that I noticed, though, was endocarditis. I was hospitalized with the endocarditis and then treated for that. Then I actually landed into an ED department, and there the emergency doctor had asked me if I had ever been diagnosed with a connective tissue disease, because I had these weird lesions on my leg and also an enlarged spleen and pancreatitis. And I had no idea what he was talking about. So he asked me, had you ever been tested for lupus? And I knew what lupus was because I read a book in when I was in 8th grade called called 13 is Too Young to Die. And it's about a girl that passes away with discoid lupus, actually. And so I kind of freaked out a little. I did some reading after he said that, went to my flight doctor, and it was kind of like the stars aligned at that point, because the flight doctor's sister actually had lupus.
Wow.
So he knew exactly all of the testing to do and everything. And that's my journey. So he ran all of the blood work, came back positive. And I think most lupus patients out there understand the gamut of testing that, you know, the blood work and everything that goes through it. And so came back positive. I finally had a diagnosis. I was happy with the diagnosis, but I wasn't happy about the diagnosis.
Yeah, it's definitely a bittersweet moment, right? We're happy that we know what's technically wrong, why we're feeling so sick, but it's not a diagnosis that anybody obviously wants to receive.
No, and the book that is out there, it's a great book, and it is written for maybe a teenage level, but it does give you a look into the life of a teen that is dealing with discoid lupus, which affects the skin. Right. So, yeah.
And I know just from being friends with you, that is something that you've dealt with.
Yes.
And you've told me in the past, as far as the hair loss and having like scarring on your scalp. So we have a lot of people in this community that deal with hair loss, complete hair loss, whether it's from disease activity, maybe a combination of disease activity and treatment, and maybe other autoimmune diseases, like you have a specific type of alopecia, I believe you've told me about that came with it.
Yep. Alopecia areata. It's kind of a tongue twister to say, but
how did all that sort of come to be?
Well, I think in the lupus community, or in a chronic illness community, or I should say even autoimmune community, I feel kind of like Little Red Riding Hood with my basket, and I'm collecting like all of these different autoimmune diseases, because it just, when one happens, it's a domino effect.
Right.
So
then you
I
collect the
picked
hair
up,
loss.
I picked up alopecia areata, and now I'm on to the big bad wolf, which was, of course, my dermatologist that had to tell me, yes, Nicole, you definitely have alopecia. I thought it was just the lupus, because that is a symptom
Right.
from lupus, is people with hair loss. It just, and that's part of the discoid, because our skin is made up with our hair, our nails, and our skin, of course. So it's all part of the lupus symptoms. But this was and so I kept asking him, are you sure it's just not the lupus? And he sat very frank with me. And I think I told you this in the other episode, that he had to really pull the slide of my biopsy for me to take a look and explain the difference between a lupus patient just losing their hair and gaining it back, and then also what your skin looks like when you have alopecia areata. And I said, so what you're telling me is I have alopecia areata, just another one
to add in there
to throw in my basket.
When you were first having the
Right.
hair loss, I think you had mentioned to me at some point that, trying these different lupus medications to see if it would obviously calm down the immune system.
Yes.
And bring that to a halt.
Yes.
But you didn't have any luck with those at all.
No. So in fact, what happened was, so it started off with a quarter size bald spot in the back of my head, and I felt it. And my hairdresser even warned me about it. She said she didn't see any hair follicle growth. At that point in time, it was a quarter size. Then a few months later, I reached back and it was the size of the palm of my hand. That's when I went to the rheumatologist. Rheumatologist told me, I need for you to see your dermatologist. And the dermatologist gave me several suggestions on what we could do to try and regrow the hair. I was specifically thinking that at that point I was on Arava and Cytoxan, a little bit of Cytoxan, and Benlysta for the lupus. And I thought the Arava I was trying to convince him it's the Arava that's giving me the hair loss. No, Nicole, you truly do have the alopecia. So he did inform me that there were some medications out there that could help treat the hair regrowth. And I said, okay, well, let's do it. So the first thing that they did is they gave me injections of Kenalog, which is steroids. And I started with about 30 injections at each visit. So
and this was directly into your scalp?
Into your scalp, all over,
Okay.
especially in the areas that, so alopecia, it's a little bit different than when I lost my hair with chemotherapy. So this is the second time. Alopecia was much different. It comes out in spots, almost polka dot like.
Okay.
And it was circular in nature. So
what was the chemo, just for people here that are on chemo? What is that? What did that
so
look like?
That looked like complete, oh gosh, I think that's sometimes a little bit more traumatic. Well, they're both traumatic, but with the chemotherapy, that came out definitely in clumps, and very easy to pull.
Okay.
So I would just pull my hair and it would just be in strands, and it didn't hurt at all.
Okay.
It was just like it fell, and I would wake up in the pillow. And so I went in steps with that. It was very new. I just said, please cut my hair short. Wasn't ready for them to shave it. Then at that point in time, when it got worse, then I had them cut it in a very short pixie cut. But then it it was almost like it all fell out all at once, and eyebrows as well.
Oh, wow.
So with the alopecia, though, it was much different. It was slower to happen. And when I pulled my hair, it did not come out in clumps. It was just strands that would fall. And all of a sudden there would be these circular marks all over my scalp.
Okay.
So it was much slower, much different. than that. I would say a little bit less traumatizing for me than the first go
Right.
around.
Now, when you started the shots
Yes.
in the head,
Yeah.
did they say, was there a plan of, okay, if this works, it will take this long until you see maybe some hair growth?
Yes. He did say it would take a few months because steroids to get into the body, of course, it's slow moving and your body needs to absorb it. But he also did say that it might not work. So he gave me some other suggestions with, there's topical, you can use a topical ointment that is also steroid based, and that is bought through a company and it comes out of pocket. It's not something that is through your insurance. So the catalog shots were through my insurance. Great. The paste, however, not super expensive for the wallet, but enough to come out, monthly,
Right.
where it's like $50, $60. But I tried it anyway. So those two things alone were great suggestions. I love my dermatologist. However, my hair was falling out quicker than the steroids worked. So at that point in time, he just looked at me, and also my eyebrows. My eyebrows were starting to get affected. My nails definitely were affected. I lost all of my fingernails, my toenails. It was extremely painful to wash dishes or work with clothes. So I started buying the press-on nails and things like that. And there's also another procedure that's called PRP, and that does come out of your pocket. It is an FDA approved procedure. Again, what they're doing is they're basically taking your own blood, centrifuging that, and then again injecting into your scalp. It may work, it may not. And so when I heard the may not, I thought to myself, I don't think I want to spend that amount of money when the Kenalog shots didn't work.
Right.
And my hair was falling out. And I figured, you know what, I'm going to just embrace this and not let the alopecia control me. I'm going to control it. So I called my mom and I said, can you FaceTime with me? I'm going to shave my head finally. And she said, okay. So called her up and I shaved my head right down the center, just like that. So there was no turning back. We laughed because it was like the clown wigs, where it's bald here and then you have hair there. And we laughed. I cried a little bit and then I'm just, why are you crying? You have this beautiful wig to put on. It wasn't this one, it was another one that I had purchased. And I did my wig research, which probably that's a whole nother episode that I can really get into and make it helpful for others. And so I had already done all of the research. I knew I had this wig. Yes, I lost my hair before with chemotherapy, went through it, had the wig, but the wigs back then, not like they are today. And, even the vocabulary to say wig is not like, oh, you have to wear a wig anymore.
Right. And that was something I wanted to ask you, because we had talked about this earlier, was the emotional side of losing your hair, whether it's lupus, alopecia, a combination of the two. Your immune system is attacking your scalp to the point where you have the scarring. So obviously there's an emotional journey in, one, seeing that your hair is falling out, two, trying all of these different treatments, and then three, sort of preparing yourself for, okay, if I want to have hair, I'm going to have to go into this new world of wigs, right? Which I absolutely agree with you. I feel like in today's world, if you hear wig or extension, it doesn't sound like something other people do. It's so common now.
Yeah, they've made it so affordable.
Yeah. Oh, and we have so many more options. And I feel like social media, we get to see it a lot more. People that even have beautiful heads of hair wear different wigs just to change it up, right?
They do. Absolutely. So, actresses.
Oh yeah.
I can tell you right now, some of them
are wearing
some,
they're wearing
there's a great
human hair, incredible wigs that are
Yes.
extremely expensive. I
Yes.
mean, they're stunning. But so before you even get to that point, because I absolutely do want to have a second episode with you where we just kind of go into wig language for people that are starting that journey. But what was like the low moment of the emotional journey, and then now the higher moment of accepting and actually enjoying? Like, you have so many wigs.
I
She
do.
is a wig
I'm
collector
addicted.
now.
Oh, my wallet knows it too. But yeah, as far as the emotional journey, yes, there's that grievance process, because it's a loss. No woman or man, for that matter, likes to lose their hair. And for me, I used to spend hours, minutes of my life that I will not ever get back, because I used to think my hair was the only thing that was great on me. Like everyone, my hair was like my identity.
Right.
Even through high school and college, I spent hours, and people would comment on my hair. So the first thing that I thought of was like, oh my goodness, I'm not going to have my hair anymore. And I would definitely go to extremes to get really good hair color and quality. And even I paid for extensions as well at one point in time. In fact, that is how I was able to hide the alopecia at first. I think it was triggered way earlier, but the extensions hid it for a while until they really started falling out. I couldn't hold
for them to probably grab on.
Exactly. So you go through that loss and almost a hatred to your body. First of all, I hated lupus. I hated the fact that I had another illness to contend to. I'm thinking to myself, what on earth? I'm already getting treatment for the lupus. Why now another thing in my life, to balance all of this? And not only that, I'm going to go out and see people. What are they going to say to me? How are they going to feel? Even my daughter had mentioned, I braved it, and I went out with a scarf, and my head was shaved, and she said, people, they stare at you, Mom. And I said, I know, I can feel it. It's a little uncomfortable. And so you go through this really uncomfortable stage. And then I just did not want alopecia to control me. So now I do not get to the point where my hair has a chance to fall out anymore.
Right.
Because it's not going to go away. Some people do get scarring, which I have, which means that the hair follicles will never come back. Some people do get the alopecia areata. The hair follicles grow back with the Kenalog shots, and they get thicker hair and beautiful hair. But then there's always in the back of their mind that this could attack at any moment. Stress could hit. I'm not going to give myself that chance. And I love my wigs so much now. They've become a part of my hair. So now my head. So
and
now
outfits.
Yes. It's like it's an accessory. It's like jewelry. What wig can I wear today? What am I feeling? Am I feeling blonde? Am I feeling brown? Am I feeling like this? Purple and pink?
I don't know. Reminds me of you like a Lupus wig.
Yes.
Right. With your purple dress.
With the purple dress. And I had purple sunglasses on earlier. And so now I feel like the wigs are an absolute part of my life, and part of, it's almost like, have you seen the show Schitt's Creek?
Yes.
I'm Moira.
Yeah. Yes.
Yeah. You don't put the purple next to the brown. Okay. They don't match. They don't get along. No, but still, I mean, that's true. That's kind of how I feel now. And I know that it's not that easy. For me to sit here and explain my journey in a short amount of time, it definitely is not easy for anybody to lose their hair. It's extremely traumatic. And I had a lot of tears. It took a long time to accept the wigs. For example, I had no idea. It just always felt like I would put it on. Nope, it looks too wiggy. Somebody's going to know. And not one person has ever come up to me and said, oh, I like your wig. Like today.
Oh, yes. We were out earlier and she had a lot of compliments on this wig from the women in the store.
Yeah. I like your hair, they said. And I eventually confessed that it, you know, and told them my journey, but it was at the end, you know, I just simply say thank you and walk away thinking, oh gosh, I kind of lied, but at the same respect, yeah, it is my hair. This is my wig. I bought it. So thank you.
And it looks beautiful. I mean, you
Thank
have so
you.
many different wigs, and I want people to know, like, if you follow her on Instagram, it's Loopy Nick. We'll put it in here.
Okay.
You talk so much about different wigs and some of the people that you follow and just sort of that journey, because there are so many different types of wigs. And if you've never held a wig in your hands or tried one on, and then you see obviously some of the price tags, it's like, okay, I don't want to choose the wrong wig because then I'm never going to wear it and I'm out all this money, right? Because it's not like these are things you can wear and then return. It doesn't work like that in the wig world.
Nope, it sure
They're
doesn't.
very specific about touching them and taking the tags off and everything else.
And
So
there's a lot of terminology with it.
yes,
Knowing what style you want, whether you want synthetic or real hair. I will have to say that if anybody is going through the same journey, to always check with your insurance company, because the insurance companies do have, most of them do have prescriptions ready for, they call them a cranial prosthetic. That's what you would ask for, not a wig.
right.
You have to use the terminology.
And
Cranial,
you get a certain amount of money towards it,
yes,
right?
exactly.
Yeah.
Some insurances are better than others. Mine, I can tell you, was not. They think that, you know, just one wig for your whole entire lifetime is going to last you. It doesn't.
Well, and that's something I want to definitely talk about we're going to have a second episode where we actually just talk about the wig terminology, but you know, synthetic and human hair are completely different worlds. And perhaps, you know, trying a synthetic wig to just sort of get the feel of it and getting comfortable maybe before you spend all that money. Those are things I would love for you to share, you know.
Absolutely. Yeah. Because I can honestly say that when you do buy a wig and you put it on your head, you're not going to like it the first time at all. It takes a few minutes, even for the first time when you put a wig on, for you to look at yourself, of course, differently, because it's not the same. You don't look the same at all by any means. Even if you try to buy a wig that is so close to what you naturally have, it doesn't feel right. You have to play around with it. There are steps, and I learned that throughout. I did find a company that I do like to go with, and I've learned how to put the wig on, what steps I need to take to make it look right. Right. Sometimes you have to take it to your hairdresser to maybe get the bangs the way you want them, or even the shading. Sometimes with the human hair, you can get the highlights put in and the colors different. I have a synthetic one on right now. So this color will never fade, and people pay lots of money to get it fade or to get it permanent. But I will tell you that this is a synthetic wig, and it takes a lot of care. That's probably why I have so many, so I can rotate them. Right. And then also the synthetic is kind of like a doll's hair in a way. So there are chemicals that you can buy, or I should say shampoos, conditioners, restoration items that we can talk about in the other episode, that does help to the longevity of the wig too. And I'll show you. So I'll show you what my head looks like now. So this it's cold.
Your hair is the same color as mine.
It is. Yeah. And Marisa did not know that. I
always thought she was a blonde.
Yeah. She met me with a wig on. So, but yeah, this is my hair color, and you can see where the alopecia is actually targeting. So you can see kind of these circles, and I felt more comfortable going out in a wig than this, because I don't know. I mean, and everyone feels different. it didn't feel uniform
Okay.
coming in like the last time. So when I had the chemotherapy and lost all my hair before, it came in
All came back,
uniform,
right.
but this is a little different, and it's scarred. So fancy scarves, and I'll wear those. I am a beanie fanatic. I will make my own beanies. I'll wear those. You can't even tell. And then the wig. And again, nobody even asked me if that was a wig. So
Oh yeah, no one today knew. Well, I appreciate you explaining your story.
Oh
and
yeah,
sharing it, 'cause,
absolutely.
you know, hair
Yeah.
loss is not an easy story for women or men.
It's not. It really is. Again, it's a sense of loss. So anytime we lose something, you always go through that grievance, the stages,
Absolutely.
and you can circle back to those stages. So I've been angry before where I'm like, oh, I wish I just had my own hair, especially during cold days. But then I think back, wow, what did I do today? It took me a lot more time to put makeup on, and I just put my wig on and off we went.
Ready to go.
And and it stayed.
And it looked great.
And it stayed.
Right.
It stayed, like all of the strands stayed the same in this humid weather.
Yes.
And if I had had a curly wig on, the curls would have stayed the same. It's magic. And so like I said, I'm going to make it, I want to control this. It's not going to control me.
No, well, it does not. I mean, you do an incredible job. I love when you share your story on Instagram and on Facebook. She's very, if you don't follow Nicole, she's very transparent. She's very funny. You have a great sense of humor. And I think you really you know, I feel like every advocate in our community kind of has an area that they really share a lot about. It's just an area that's, you know, stuck with them or they're really passionate about. And for you, it's definitely hair and wigs. And on your Instagram, you give a lot of great information, even on your Facebook.
Yeah, I try to.
So I thank you for that. And
you're welcome.
Yeah, I mean, definitely let everyone know how they can follow you.
Yeah, so on Facebook, I'm Nicole JG. So you'll see Nicole JG. And then on Instagram, it's at Lupie, LUPIENIC.
Yes. And they can reach out to you because I've sent a lot of people your way over the years, you know, having hair loss or treatment questions or even wig questions. And I'm like, you need to speak to Nicole. She is the lupus and wig expert.
Just DM. Yeah, I've been through, I mean, having lupus since 2005 and having several medications that did not work and being a medical professional, I don't know. There's been a lot that has gone on. And again, like I said, I feel a little bit like Little Red Riding Hood, kind of collecting and to try to balance our bodies. Once one thing is disturbed, it's a domino effect, as you know. And so this was one area that I know is very traumatic, and it goes right along with the mental health area. And absolutely. I can't even imagine, you know, how everyone feels when they lose their hair at all. I mean, I do know how I felt. It's hard to explain, but it was definitely a lot of crying and happy tears too, especially once I found the wigs. I felt like, oh my gosh, I found my best friend. I found a company that really has helped. And now I can share this with others, and also how to put it on, what to look for, the terminology, and share that. And maybe others won't feel so lost, you know, with it.
It can definitely be an overwhelming to start in.
It's not fun. Yeah.
Well, you're a great teacher. And there's actually some really good organizations out there that help people that can't afford wigs. I know that every time in Florida and also New York, whenever I had an appointment at my hematologist, oncologist for my infusions, they always had boxes of wigs that people would drop off that either they never wore because they were either the wrong color, the wrong style, they didn't need them anymore, or, you know, they were just donated. So, I mean, there are, you know, other ways to access these things.
Yes, without
if you don't have the financial means. So,
and a lot of the companies that I've researched, they also offer payment plans. So Affirm now, the Sezzle payments where you're
pay, things like that.
Yes, I mean, the community is much larger.
Yes.
And like you said, with social media, the verbs, the words, the nouns, wig is just another part.
Yeah.
It's not like, oh, I'm sorry, you have to wear, nobody
Oh, yeah,
knows. And it's more affordable, even with the extensions,
yes. And they like complement your outfit. Like today,
exactly.
She wore her Lupus purple dress.
I was completely in color. And I could pick, but now, if you get like me, then it can become a little bit expensive when you look back.
Has become quite the collector of the wigs. So, well, I'd rather you collect that than any more autoimmune diseases. So
exactly. We're stopping there at alopecia.
Put that basket away. So thank you so much for being here.
And no, thank you.
Definitely.
For having me again.
Yeah. I appreciate the more intimate setting. We were in the same place at the same time.
Yes.
And you can follow us. Come back next Tuesday for the next episode. We're going to have Nicole on a part 2 so that we can actually go through how to find the right wig for you and how to take care of them, how to put it on, and all of those good things. So,
you're welcome. That'll be exciting because I don't know. I want y'all to be able to feel a sense of relief that you have options and that this is not the end of the world, that this is definitely doable and that you're able to control what hair follicle comes out of your head and that you have options to look just as beautiful, if not more than your hair. It's not you. I've learned that it wasn't my hair. Actually, it was, my personality. I've learned that now that shines. It's not what was on my head. Like I used to think.
You're a beautiful person.
Thank you.
And out. She really is. So definitely go and follow her. And thank you for being on this episode.
Thank you for having me again. I love sharing. So thank you.
All right, everyone. Well, Tilly is brought to you by the Lupus Foundation of New England. You can go back into our video library here on Facebook, also on YouTube, and you can watch all of the previous episodes. And if you go back, I believe you were in season 2, you can learn more about Nicole's journey as a nurse, as being in the military, and being diagnosed with lupus. So thank you, everyone. I hope you have a great night.
Thanks.
Take care.
Good night.
Bye.